Hello, hello, Dr. Roy here. So, in honor of March as Women's History Month, today's theme is Women's Health Wednesday. And today's specific topic is a public health crisis. And no, it's not COVID 19, but in fact, it's opioid use disorder in women. So, let's take a step back. Drug overdose was an epidemic well before COVID 19, mostly driven by opioids, first pills, then heroin, and then fentanyl. But in 2020, after the start of the COVID 19 pandemic, overdose deaths skyrocketed 30%, claiming 92,000 lives in the United States. Sadly, the trend continued in 2021 when the CDC reported that over 100,000 people died by an overdose. So, why is this happening? Unfortunately, the same public health measures like isolation and social event shutdowns that kept SARS-CoV-2 at bay increased the risk for drug and alcohol use, return to use, or relapse and overdose. In addition, record levels of job, food, and housing insecurity were all risk factors for substance use. And of course, the despair from seeing loved ones get sick from COVID, get hospitalized, critically ill, and then die triggered immeasurable sadness and grief. People self medicated with substances. So, why should we pay special attention to women? It turns out that there are gender differences related to substance misuse. One, since 1999, deaths from prescription opioid overdoses increased 642% among women versus 439% in men. Second, women are prescribed opioid pain medications more often than men. Third, women may become dependent on opioids after less time using them. Fourth, a larger proportion of women with opioid use disorder have histories of trauma. 5. The number of pregnant women with opioid use disorder at the time of labor and delivery increased fourfold from 1999 to 2014. And then 6, women with opioid use disorder at the time of delivery are 4.5 times more likely to die, 3.5 times more likely to have a cardiac arrest, and twice as likely to have a complication such as preeclampsia or stillbirth. So, what's the connection between mental illness and opioid use disorder in women? Women with opioid use disorder are 5 times as likely to have a mood disorder such as depression or bipolar disorder, and 3 times as likely to have an anxiety disorder. So, how do we treat women with opioid use disorder? First, we need to shift the culture around addiction and treatment by dispelling the myth that addiction is a moral failing or weakness, but rather addiction is a treatable chronic illness of the brain. Second, we need to expand access to evidence-based treatment, including medications such as methadone, buprenorphine, also known as Suboxone, and naltrexone, as well as access to counseling. And third, we need to engage women with opioid use disorder in care that is trauma-informed, trusting, and compassionate. And fourth, we need to collaborate with a woman's entire support system, including her partner, children, parents, friends, and others who support her treatment and recovery. I'm going to end today's show with a joke that a female patient once told me. Why did Dracula go see the doctor? He couldn't stop coughing. Be well, be safe. Until next time.